Hello, everybody, and good evening. Uh, you, as you people are aware, the situation all over our world is worsening, and the spread of COVID-19, coronavirus, novel coronavirus, is spreading all over the world, and almost more than 500,000 people is got infected, and so this is a difficult time for the human race at present, but uh, we have to face it. And as a healthcare worker, we are the front fighters who has to face this situation at present. And nowadays, all over the world, hospitals are involving non-intensivists, or you can say non-anesthetists, in more and more in the care of COVID-19 patients, and then we have to take care for the sicker patients with lesser trainings. So today I wanted to discuss something which will help our practitioners in saving themselves and saving the spread of the disease COVID-19 to the healthcare workers, to other patients, and this will be very helpful. So actually, first I will introduce myself. I'm Dr. Muzaffar, intensivist working in as a specialist intensive care in Dubai at present. We are in the second phase of COVID-19 spread, so we are preparing, and we are actually giving training to our non-intensivist physicians for PPE use. So I wanted to discuss it with you, all the people. This is a safe practice which the we have to follow the CDC guidelines. So I will first start with one of the chart which is prepared by CDC, at which you can see here. So we have to understand how to put it on and how to remove it, and both the procedure is very important, which prevents you to get contaminated if you use PPE by proper method. So you will be more safe. Now, starting with there are, you can see, three charts available from the CDC. First one is for putting it on. It's easier. It's not so difficult. And the other two charts are for the removal. From the start with, I will say the removal is actually more difficult than putting it on, because when you are putting it on, the PPE is not contaminated, so you will not get contaminated by use by any means. But the thing is that when you are removing it, most probably PPE is contaminated, so you have to take care more. So first I will start how to put it down. You have to remember the sequence of PPE. First you have to put a gown, then after that you have to put a mask or respirator, and that means you have to either put simple surgical mask, or you have to put N95 mask. Then you have to put either goggles or shield, and finally, fourth step, you have to put your gloves on. uh, First, we will go for the gowns. You have to use gown which should be at least waterproof, and it should cover from neck to the up to the knees. So, and it should cover your arms up to the wrist, and it should wrap around the back, and it should also cover your back should not be open. And either there are many kinds of gowns available which are waterproof. Some has some ties, some has some velcro, some has some buttons, so you have to use it properly, whatever type of gown is available. Some gowns are available which can be tied by the operator only, and sometimes you will require help to of some of your colleague to tie it on the back. But take care, you have to tie on the back only, don't tie in the front, or so the front should be completely closed and tie should be on the back. And for the now coming to the mask, after putting your gowns on, and all the ties has to be completely tied up, should be properly fixed. After that you have to put your mask on. So there are many kinds of masks available which can be used. If you are using mask with the ties, then one tie should come on the back of your head and one should come on your neck. If this is elastic type of thing, then again you have to put in the same position, but it should not be tied up. Some people use crossing method also, in which the upper one should go to the neck and the lower should go to the back if it is elastic tie. But whatever method is has been used, recommended thing is that secure ties or elastic band at the middle of head and neck. Fit the flexible band to the nose bridge, and you have to compress it to fit to your nose. And the lower part should come below the chin, and it should snug your face completely. So this is very important. It should be sealed from outside, all the sides. And if you are using N95, you should get it checked for the leak test properly, because the normal mask, which soft mask, it can be tied up and it can stick to your face on tying tight. But when you are using a N95, which is preformed shape, so if you are putting it on without means without checking the size, then it may leak and you can get infection, or the air which is infected. So this is you have to take care. If you are using N95, get it checked prior. You should know your size and you should use your size only. Then after the putting a mask, the next step is to putting goggles or the face shield. So because it's still we don't know what is the actual transmission method, airborne or actually droplet spread. WHO is giving always the conflicting things, but you have to face the patient from very near, so you have to take care about it. And you should save your eyes also from splash, even possible that you can get a splash of body fluid. So you should take care for your eyes. You have to put goggles, or you can put a shield which will cover your whole face and eyes. And I think the shield is always better than goggles, because goggles will only take care for your eyes, but the shield will cover your whole face. So I think it is better, especially if you are going to some invasive procedure, including cell like intubation or some bronchoscopy, or you are going for endoscopy or something like that. Then you are more exposed, so take care at that time. If you are going for any procedure, I will suggest you to go for the face shield, not for the goggles. And the last one, you have to put gloves. Gloves, you should use your size, and you can use double gloves if you are going to do some invasive procedure. And the glove size should be fit for your hand, and you have to pull the base of the gloves up to the wrist of your gown. So the wristband of gown should go inside the gloves. It's very important to make a continuum from the gloves to the your gown wrist, because if there will be gap, the secretions can go inside. So you have to take care for that. After putting, CDC recommend that you have to use safe work practices after putting your PPE. So you try to keep your hands away from the face always, because you are touching here and there, and after that you are touching the face. So this increases the chance of contamination and infection to spread to you. So you have to take care that you don't touch your face after putting the PPE. And even you have to limit the surfaces touched, means you minimize the touched number of surfaces you actually touch. So you have to take care for it. And whenever your gloves got torn or heavily contaminated, please change it, because the more it will get contaminated, more you will have a chance to contaminate other surfaces, or yourself. So try to put change gloves when it get torn off or it get heavily contaminated, and every time perform hand hygiene. And it is always recommended before putting PPE, always go for hand wash before putting PPE. That's also important. Whenever you are going for invasive surgery, you can go for hand wash with soap and water, and after that you can go use at least 70% alcohol fluid. But use hand hygiene, perform hand hygiene on regular basis. So this is the safe practice from the CDC after putting PPE. There are two methods of removal of the PPE from the CDC, and actually they have given the example 1 and example 2. You can see this example 1, in which you remove gloves first, then you remove goggles and face shield, then you remove gown and mask and respirator and the last, and after that you wash hand. This is the first technique. And the second technique, in which you remove gown and gloves together, and after that you actually remove your face shield or goggles, and in the last you remove the mask and respirator. I personally prefer example 2. It's easier, because it's recommended, both technique has been recommended from the CTC. I will not say what is the better one, but I prefer the second one always, because for me it's easier, and I feel it's a way in which you contaminate yourself lesser. So in the case of removal, it is very important. I will discuss first example 2, then I will discuss example 1. For example 2, which I prefer, this is the method applied. So first, what you will do, you have to so you have to understand that the outside of the gown and the gloves are contaminated, so it should not touch your inside clothes by any means. So what you have to do, you have to hold your gown from in the front by your gloved hand, and you have to pull it gently towards the front. So what will it will cause the band which has been tied on the back, it will break, and then slowly you have to take your gown out, so that you remove your gown and your gloves together without touching any inside part of your clothes or even the gown from inside. You don't have to touch any part from inside. So you have to remove gown slowly and slowly, and when you come to your hands, you remove gently your gloves and gown together, and you have to throw your gown and gloves together to the garbage box, means medical garbage box. So you have, while removing gown, fold the roll gown inside out into the bundle. So you have to roll your gown and gloves together in a bundle, and after that you have to throw it in the waste container directly. And after that you have to remove your goggle or face shield. Don't touch the front of the face shield or goggles by your hand, because mostly it's contaminated. You assume it contaminated whether you have seen secretion or not seen secretion, but you have to assume the front of the face shield or front of your goggles is contaminated. So you hold your band from the back, and then you have to remove from the back slowly, and when you without touching the front part. And so whenever you feel that you have touched, whether you are removing your gown or you are removing the face shield by mistake, or sometime you have touched the front of your face shield or mask, use soap and water and possibly alcohol based hand rub to disinfect, sanitize your hand. So after removal of goggles or face shield, whatever you are using, finally you have to remove your face mask or respirator or N95. So in that case again you have to see from the back. You have to either open the tie from the back, or slowly you can pull it, so it will break automatically. If it is soft, if it is elastic, then you have to remove from upper one first, then the second the lower one you have to remove slowly and slowly. You don't snip the elastic band, because it will form more of the aerosols. So you have to try to remove it slowly, and then you have to throw in the waste container. But take care, there are a recommendation from the hospital wise. If you are taking care for a isolated patient, usually the container should be kept in outside the room, so you have to remove your mask or respirator outside the room of the patient, so that you will be in the safer area to breathe. Okay, and then finally, after removing mask or the respirator, you have to wash your hand using alcohol based hand sanitizer, or and after that you can wash even with the soap and water if you want. I will also discuss the other example for removal of the PPE. So in this technique, there are actually 5 steps in place of 4 steps of the example 2, in which you have to remove the gloves first, then you have to remove goggles and face shield, and third you have to remove gown, and finally you have to remove the mask and respirator. I will discuss again it that you have to remove the mask in the last. You have to remember it. You cannot remove mask and respirator inside the infected patient's room. So when you have removed everything, you have to come out with your face mask outside. Definitely, even some of the hospitals are recommending that you have to remove the PPE outside of the room. That's also acceptable, but it's not acceptable that you remove your face mask inside the room of the patient. So so in this case, you have a specific technique to remove the gloves. So what you have to do, with a pinch of finger, you have to hold the means contaminated part, means external part of the gloves, but with a pinch, 2 finger or 3 fingers, slowly and slowly you have to remove the gloves and keep in the same hand, which gloved hand. The other hand you have to insert on the if you have removed from the right hand, then you have to put the right hand finger below the wrist band of the gloves, and then you have to remove slowly. But if you after removal, it will automatically, the first gloves will go inside the second gloves, so you can make like a closed area, and after that you can directly throw inside the container. Anytime you feel your hand has got contaminated by the secretion, then you have to wash your hand with alcohol based sanitizer. Then you have to remove the goggles or face shield. There is no difference in the first and second technique. Don't touch the front part of the face shield or goggles. Hold your tie from the back, and slowly you have to remove it. Try to avoid any snipping, because it will make more of the aerosols when you are removing gowns. So the technique is same. Don't touch any part on the front. You have to tear down the or open the knot of the from the back, and then you have to slowly remove your gown and fold it like that. The external part should go inside, and internal part should be, when it's non-infected part, will be always outside to touch, for touching. So you cannot touch outside, you have to touch inside part only. Okay, then finally you have to remove the mask. But the technique is same in the first example and second example. If it is a tie, you can open it, or you can slowly break it if you want. And but if it is a elastic band, then you have to remove slowly one by one. And always take care, don't remove your mask or respirator inside the room of the patient. So you have to remove it always outside, specifically mask. and if recommended from your hospital, better remove all part of the PPE outside the room. Always wash your hand with alcohol based, more than 70% of alcohol based sanitizer immediately after removing of all PPE, and perform hand hygiene between steps if hands become contaminated, and immediately after removal of PPE. It's the most important thing to follow. Always hand wash, or you hand cleaning, hand sanitization is the best technique to stop spread of any disease. So this is the best proven technique till now, which can actually uh, prevent cross contamination between the patient, and it can save life. I have tried my best to explain this technique. Thank you very much for being with me. Good evening, best of luck for caring your patient. Thank you very much.